Aortic intramural hematoma, or IMH, is a serious and often underdiagnosed heart condition. It's essentially a blood clot within the wall of the aorta, the body's largest artery. Unlike a full aortic dissection, where blood flows through a tear in the inner layer and creates a separate channel, in IMH, the blood is contained within the layers of the aortic wall itself. This can lead to serious complications, making understanding this condition crucial. So, what causes this internal bleeding within the aortic wall? The exact causes are still being researched, but several factors significantly increase the risk. High blood pressure is a major culprit, placing excessive stress on the aortic wall. Atherosclerosis, or the hardening of the arteries due to plaque buildup, can also weaken the aorta. Other potential contributors include trauma to the chest, genetic conditions affecting the aorta's structure, and certain inflammatory diseases. To understand the danger, we need to delve into the pathophysiology. The hematoma, this collection of blood within the aortic wall, disrupts the normal structure and function of the aorta. It weakens the wall, increasing the risk of aortic dissection or rupture, which can be life-threatening. The hematoma can also compress nearby structures, potentially affecting blood flow to vital organs. Over time, the hematoma may resolve on its own, remain stable, or, most dangerously, progress to a full aortic dissection or even aneurysm formation. Estimating the exact prevalence of aortic intramural hematoma is challenging because it can be difficult to diagnose. However, it's estimated to account for a significant percentage of acute aortic syndromes. It's generally seen more frequently in older individuals, typically those in their 60s and 70s, and those with pre-existing conditions like high blood pressure. While it can occur in both men and women, some studies suggest a slightly higher prevalence in men. The symptoms of aortic intramural hematoma can be quite varied, and sometimes there may be no noticeable symptoms at all. When symptoms do appear, the most common is sudden, severe chest pain, often described as sharp, tearing, or ripping. The pain can also radiate to the back, neck, or abdomen. Other symptoms may include shortness of breath, dizziness, fainting, nausea, vomiting, and even neurological symptoms such as stroke-like symptoms if the hematoma affects blood flow to the brain. Diagnosing aortic intramural hematoma requires advanced imaging techniques. A CT scan with contrast is typically the first-line diagnostic tool, providing detailed images of the aorta and allowing doctors to visualize the hematoma within the aortic wall. MRI is another excellent imaging option, offering even greater detail and the ability to assess the age of the hematoma. Transesophageal echocardiography, or TEE, a type of ultrasound performed through the esophagus, can also be used, especially in emergency situations. Aortic intramural hematomas are often classified based on their location in the aorta. Type A IMHs involve the ascending aorta, which is the section closest to the heart, and are considered more dangerous. Type B IMHs involve the descending aorta, the part that travels down the chest and abdomen. Another classification system categorizes IMHs based on their evolution: acute, subacute, and chronic, each requiring different management approaches. Treatment for aortic intramural hematoma depends on the location and severity of the condition. For type A IMHs, immediate surgical intervention is usually necessary to prevent life-threatening complications. For type B IMHs, treatment may initially involve medical management, focusing on controlling blood pressure and reducing stress on the aorta. Regular monitoring with imaging is crucial to track the hematoma's progression. In some cases, endovascular repair, a minimally invasive procedure where a stent graft is placed inside the aorta, may be necessary to stabilize the aortic wall. While it's not always possible to prevent aortic intramural hematoma, there are several steps you can take to reduce your risk. The most important is to manage and control high blood pressure through a healthy lifestyle, including a balanced diet, regular exercise, and, if necessary, medication. Quitting smoking is also crucial, as smoking damages blood vessels. If you have a family history of aortic diseases or genetic conditions affecting the aorta, talk to your doctor about screening and monitoring. The prognosis for aortic intramural hematoma varies depending on the location, severity, and timely treatment. Type A IMH generally carry a higher risk of complications and require more aggressive treatment. With prompt diagnosis and appropriate management, including medication, surgery, or endovascular repair, many patients can have a positive outcome. Ongoing research is focused on improving diagnostic techniques, refining treatment strategies, and identifying genetic risk factors to better predict and prevent this potentially life-threatening condition.